My name is Rachel Ignomorello, and I'm your bariatric dietitian. Welcome to Education Class 3. As we get started, do your best to pay attention, take notes, and remove distractions. Our topic today is the 2-week pre-op liquid diet. I know it's not everybody's favorite part of their journey, but there are some really important reasons why we do it. During the 2 weeks before surgery, we have you follow a very low carbohydrate liquid diet. Your body is forced to use fat as fuel instead of carbohydrates, and this will lead to fewer complications. During the procedure, the team has to actually lift your liver, and if it's really large and fatty, it can make a simple operation much more complex. By following our pre-op liquid diet, it will significantly shrink the liver, and with less weight comes less soreness after surgery. It also can lead to an easier diet progression after surgery because you're already practicing what you're going to be following. We know it won't be easy, but please have willpower, be strong, and remember your motivation. Surgeons can tell if you haven't followed the liquid diet, and they cannot safely perform the surgery if that's the case. I would hate for anybody to wake up from anesthesia and be told we couldn't complete the surgery. If you're going to remember one slide from class, let it be this one. It's your goals for the pre-op diet. For protein, we need you to get 100 grams per day. This helps with fullness and reduces muscle loss. For water or fluid, you need at least 80 ounces per day. That will help keep your kidneys flushing. Note, protein drink ounces do not count towards your water or fluid ounces. We want to keep them separate. As you work toward your 100 grams of protein goal, you have 2 protein options. The first is what we call cloudy protein. This basically means your protein shakes. Common examples include Premier Protein and Fairlife, but you do have a long list of products in tab 2 in the binder. If you end up purchasing and using a protein powder mix during the 2-week pre-op diet, note, you can only mix it with water, no milk or alternatives. If you like the HealthWise products that we carry in office, you can use the shakes, hot chocolate, or creamy soups without pasta as your cloudy protein. Your second protein option is what we call clear protein. This is no longer creamy, but instead a little bit see-through almost. Examples would be protein waters like Premier Clear, Protein 2.0, Isopure Protein Water, G0 has their own protein out as well. Unflavored protein powder can be mixed with other clear liquids to count as a clear protein. Some common unflavored protein brands that I like are Isopure and Undri. If you buy any of the HealthWise products, the HealthWise clear proteins would be the bouillon, gelatin, and fruit drinks. When it comes to the 80 ounces of fluid, what counts? You get to ask yourself, is it sugar-free? Is it caffeine-free? Is it carbonation-free? If you say yes to all 3 of those questions, then it counts. Plain water, the sugar-free drink enhancers like the powders and drops, even the sugar-free sports drinks. Another good one would be some decaf herbal tea. In addition, you are allowed 16 ounces of caffeinated coffee or tea per day. And yes, you are welcome. No energy drinks though. And do avoid the cream, sugar, and honey. Use your protein drink or sugar substitutes instead. The last 3 choices are great on the pre-op diet. Sugar-free popsicles, and it does need to be the actual popsicle brand, must say sugar-free. Sugar-free gelatin like that Jiggly Jello, and sugar-free chewing gum. I like to encourage the last 3 because it gives you something to chew. A great option on the pre-op diet is broth. When so many other options are cold and sweet, it's really nice to have something warm and savory. You're allowed broth if it's been strained and has not been cooked with noodles or starch like rice, corn, and beans. So the list includes broth, bouillon cubes, bouillon paste, like the Better Than bouillon, strained egg drop soup, strained beef vegetable soup, strained miso soup, or you can prepare a ramen noodle packet with water, but don't add the noodles. We're trying to avoid the starchy ones like chicken noodle, chicken and stars, and wonton because some of that starch may leak into the broth. When on a very low-carb liquid diet, we can expect some side effects to occur, but not everyone will experience these. If you feel lightheaded, drink more protein every 2 to 4 hours until you're at goal, and increase your fluids, especially those with electrolytes. Examples of those beverages include broth, sugar-free sports drinks, or a sugar-free electrolyte drink enhancer. We carry a water packet here in office. Fatigue is normal when you're on the pre-op diet. Try to increase your fluid and protein, take a nap, or add in an allowed cup of coffee or tea. If you end up with a headache, you can take Tylenol or acetaminophen, or even Excedrin tension. But note, no NSAIDs starting 1 week before surgery. If you're not sure what that is, we will go over NSAIDs in a couple of slides. On the right side with loose stools, what are you consuming? Liquids. What do we think is coming out? It's going to be liquids. Think of it as bowel prep for your surgery. You don't need to take anything for it, but do call us if it's more than 6 per day, because dehydration can happen quickly. On the flip side, if you end up feeling constipated, increase your water, get up and move around, use Miralax or a stool softener, especially if you haven't gone to the bathroom and it's causing bloating or pain. No laxatives or mag citrate though. Call us if still concerned. We're going to talk next about general medication and supplement changes. When you start the 2-week pre-op liquid diet, you need to stop all vitamins and other supplements or herbals. This may include multivitamin, vitamin D, iron, zinc, calcium, melatonin, fish oil, ginkgo biloba, St. John's wort, echinacea, essential oils, and any additional supplements or herbals. Some of these may increase the risk of bleeding, and some may increase the risk of blood clot. Before you start your 2-week pre-op liquid diet, make sure to verify all of your medications with your advanced practice provider. That may be Amber, Lynn, Sonia, or Hina. So now's a good time to make sure that your medication and supplement list is up to date. When you start your 2-week pre-op liquid diet, make sure to stop taking metformin or glucophage. It may cause upset stomach and low blood sugar. Here's the important slide about NSAIDs. NSAIDs stands for non-steroidal anti-inflammatory drugs. We have you stop taking this medication 1 week before surgery and for life after. These are very common medications as well. Advil, Motrin, ibuprofen, Aleve, aspirin, Mobic, Celebrex, BC or Goodies powder, certain combination products like the regular Excedrin or even certain cold products. NSAIDs are thought to interfere with that protective lining of the stomach from its own acid, and they can increase the risk of ulcers and bleeding, especially for those who have had bariatric surgery. For that reason, you should only treat fevers, aches, and pains with Tylenol or acetaminophen products lifelong. Don't let that information deter you from getting bariatric surgery though. The reason most people take NSAIDs is due to painful joints. Once a person starts losing excess weight, often that joint pain is reduced as well. Some other considerations. Flu and COVID-19 vaccinations or boosters are okay and safe before surgery, but try not to get them in the days leading up to surgery in case you have a strong immune response. Stop taking oral or injectable steroids 30 days prior to surgery. Examples include prednisone, dexamethasone, or hydrocortisone. Topical use is okay though. Stop taking cholesterol medications until 3 months after surgery. We're going to do blood work at that time. If we see that your cholesterol is still elevated, we will have you restart them at that time. If antibiotics are needed 4 weeks before or 4 weeks after surgery, please contact your provider here in office. Discuss managing your blood thinning medications like Plavix, Coumadin, warfarin, Eliquis, or Xarelto with your provider in office, and review your blood pressure and diuretic medications with your provider. The bottom line, make sure you've got that up-to-date medication list to discuss with your provider. Important hormones like estrogen, testosterone, and progesterone are all stored in fat cells. Rapid weight loss from surgery will increase the release of those hormones. That makes you very fertile. You need to postpone pregnancy for at least 12 to 18 months after surgery, but we do encourage closer to the 2-year mark. Please consider non-oral birth control and barrier methods when sexually active to help avoid pregnancy. You may resume your normal sexual activities as tolerated 2 weeks after surgery, but do be gentle. And note, many times women who normally do not have periods may restart or they can become heavy or irregular. We can manage your hormone medications on a case-by-case basis. Please discuss any further questions with your provider or surgeon here in office. After you finish all the program and insurance requirements, you'll get a call from Alicia here in office. She's going to schedule you for the pre-op ED3 class, second surgeon visit, and the awesome surgery date. Plan to be in office for half a day or have long appointments. When doing your ED3 class, your support person must be there even if we do the class virtually. Your support person must be 18 years or older, someone who will be with you the first few weeks after surgery, and they need to be able to understand and read in English, no exceptions at all. Pre-anesthesia testing, often called PAT, is a process provided by UT Medical Center to assess patients before they undergo anesthesia. Once you get your surgery date call, then you have the responsibility to call and schedule your PAT appointment and COVID testing. Your PAT appointment must be within 30 days prior to your surgery date. On the day of your PAT appointment, arrive 20 minutes prior, park in garage H, then go to main registration to register first. After you're registered, you'll be directed to the PAT clinic in Medical Building A, Suite 140. Your appointment will last at least 45 minutes. Here's a copy of our campus map. This map is also on the back of the PAT handout in your binder. Normally we come up from the highway on the bottom left and we're in Medical Building D, but on the day of your PAT appointment, drive straight and up to Parking Garage H. You'll walk towards Fountain Circle entrance and that main entrance registration. The arrow on the middle of the picture is where PAT is. To help not be blindsided by costs, it's important to know what expenses your insurance policy covers. Each one is different, so try to contact your company to know what they cover and know what you are expected to pay. You can refer to page 7 in your patient manual for more information. 1 week before surgery, any balance on your account at University Surgeons Associates, along with any prepayment for your surgery, must be paid in person or over the phone. A rep from our office will call you prior to this time to give you that prepayment amount. On the day of your surgery, you'll be expected to pay any amount that you might owe to the hospital at registration, including copays, deductibles, and co-insurance. A financial counselor with the hospital should contact you before surgery to discuss that amount. If you have any questions, you can contact our billing departments, University Surgeons Associates asking for Tammy, or you can call UT Medical Center Finance Department. As we start to close out on ED3, here are some things to remember. Continue your food journal. Continue your vitamins until you start the pre-op diet. Start trying products for the pre-op diet. Create an environment that promotes success. Clean out your kitchen, but no food funerals or last suppers. If you don't know what those are, it's when patients spend days and weeks overindulging on their favorite and healthy foods before surgery. But eventually you will be able to eat many of those same foods, and overindulging is not recommended. You will increase your surgery risk by gaining weight, increasing your blood sugar levels, and increasing your liver fat. Furthermore, by eating fatty and sugary foods, you are reinforcing problem behaviors. That is moving in the wrong direction right off the bat. Instead, practice these bariatric behaviors as soon as possible. Surgery is not goodbye to the foods you love. Remember that motivation, that positive outlook for surgery. So what's next? If you're having the Roux-en-Y gastric bypass, you'll be having an EGD done. That's an esophagogastroduodenoscopy. It's an outpatient procedure where you undergo light anesthesia, and it allows the doctor to examine your esophagus, stomach, and duodenum. For the sleeve, you'll be having a barium swallow study. That's an imaging test that uses barium and x-rays to create images of the upper GI tract. You'll be having your second surgeon visit, your pre-op class, ED4, you'll schedule pre-anesthesia testing, and you will need to have COVID-19 testing done 3 days before any procedure. The COVID testing must be here at UT Medical Center or any UT urgent care facility. You now have 2 weeks to complete and send in your quiz. If all your program and insurance requirements have been met, you may be submitted to your insurance provider for approval. As we close on ED3, remember, you're not an expert just because you've had the class. Reread through your class notes again and reach out to me for any questions or concerns. I'll see y'all in ED4 next, and remember, we're rooting for you.